Thank you for the opportunity to introduce the company CASC8. CASC8 is active in regenerative medicine in the context of cardiology and heart failure. The company's aim is to offer heart failure patients personalized treatment by using their own cells to treat their heart disease. CASC8 was founded in June 2016 and features an innovative technology whose patent is the exclusive property of the company. Why does such a company merit funding? Why is it justified? The epidemic of the 21st century is undoubtedly the occurrence of heart failure. Heart failure still kills more people on a yearly basis than the entire COVID epidemic taken together. It therefore constitutes a socially unacceptable problem. 1 in 3 patients dies within a year after the first hospitalization. And in addition to this very gloomy prognosis, heart failure also has a significant impact on the quality of life of the patient. To date, there is no technology capable of solving the essence of the problem, replacing the loss of functional contractile cardiac tissue with new cardiac muscle tissue. Currently, we have a number of options available for the treatment of heart failure. Medication is the first pillar, but does nothing other than treat the symptoms, the complaints of the patients that are the result of heart failure. If medication provides insufficient results, one can resort to interventional procedures, either balloon dilatation, stenting, or CABG surgery. But what these procedures do is only prevent further progression of heart failure by reopening clogged blood vessels. As a last resort, there are mechanical assist devices or heart transplants, but know that in a country like Belgium, fewer than 50 heart transplants are performed on a yearly basis due to the limited number of donors, with a population of heart failure patients of approximately 200,000. Today, we are faced with a global epidemic affecting almost 65 million patients worldwide. So this is approximately 1 to 2% of the adult population. The solution we propose is in fact simple. We sample a small piece of tissue from the patient's own heart, where the patient doesn't need it anyway, namely from the atrial appendage. Starting from the patented technology, we isolated the young precursor cells from them. This cell population is then expanded over 3 passages or 21 days to approximately 500 million cells, the equivalent of the amount of cells lost during an average heart attack. This population is then returned to the patient in a hospital setting in a non-invasive catheter-based manner, resulting in improved heart function, improvement of survival, and also improvement of quality of life. Our technology has been tested in a relevant large animal model in which we created an open chest ligation coronary occlusion for 2 hours, resulting in a substantial infarct, after which the right atrial appendage was harvested, the population of interest isolated, and catheter-based re-injected 3 weeks after the occurrence of the myocardial infarct. Final assessment was made 2 months down the road, and we were able to show that we were successfully preserving cardiac function, and this preservation of cardiac function was based on reduction of myocardial infarction as shown by delayed enhancement gadolinium images. This reduction of myocardial infarction was based on the successful integration and effective differentiation of the transplanted cells and differentiation into functional cardiac tissue. Hence, we restored life expectancy to that of a normal population. Our aim, therefore, is to establish this therapy as the standard therapy for heart failure. The obvious next step is the performance of a clinical trial. Our team is composed of people with expertise in various sectors of this technology, not only cardiology, but also financial aspects, bioengineering, immunology, and GMP production. Our scientific board is world-renowned, presenting not only scientific expertise, but also entrepreneurial capacity. In the past, a number of companies have attempted to improve cardiac function based on stem cell or progenitor technology, such as Capricorn, Digenix, or Celiat. None of them, however, have been successful. The big difference between CASC8 and these companies is that we are indeed able to replace the loss of functional cardiac tissue with new, viable, contractile, and functional myocardial tissue. The market for heart failure treatment is huge, with an annual turnover of approximately 20 billion euros expected in 2028. If the company were to concentrate on those countries with the highest incidence of heart failure, such as Germany, Spain, and Italy, and take into account a penetration rate of only 0.5%, we expect an annual turnover of approximately 11.6 billion euros. Taking into account the major drivers of the market, namely an increase in the geriatric population and the fact that more and more patients survive the acute phase of myocardial infarction due to technological progress. After the successful completion of phase 3 clinical trials, we assume the patient population to be reached within 4 years, with the projected revenues shown at the top of this slide. In a more conservative approach, we looked at what is called the hospital model. Assuming that we start off with 10 hospitals that participated in the completion of phase 3 clinical trials, and add another hospital each quarter, which would correspond to an additional 18 patients per quarter, you can see the number of treated patients and the corresponding revenues in the bottom half of this slide. On the short term, we are looking for a capital of approximately 3 million euros for the completion of the first-in-man clinical trial, of which 2 to 2.5 million euros have already been committed. Therefore, we are looking for a supplementary funding of between 0.5 and 1 million euros. I thank you for your attention.